Hello, welcome to 30 Days of IBS Foods. This is a mini spin-off podcast from my normal weekly episodes called the Inside Knowledge Podcast for people with IBS. And during April for IBS Awareness Month, I'm going to be doing daily podcasts, each one very short, digestible, if you excuse the pun, to explain to you a bit about food. So I will start with why we should eat it. Then I'll talk about how it may affect your digestion, like what could go wrong, and then talk about how to eat it or what portion sizing might be helpful for you to eat it in a small way. The purpose of doing this mini series is to try and get people with IBS to eat a better diet. Most people I work with come to me on a very restrictive diets, avoiding lots and lots of foods for a variety of reasons. And they don't really understand how certain foods could be affecting their gut. But also what you lose sight of is the good reasons for eating the food, like why you should include them. And we only think about the dangers and the things that we want to avoid. So the purpose of this April mini-series is going to be to try and reignite your desire to step outside your very safe foods and try to eat different things. Each episode will be pretty short and I will try and keep it snappy. So let's get started. I want to start with tomatoes. The reason to eat tomatoes is partly for their lycopene content. It is an antioxidant and it's really important for eye health and cell turnover. So every cell in our body uses these antioxidants to help keep regenerating and renewing. And also, lycopene has been shown to be very helpful for eyesight and improving eye health. The lycopene, which is the antioxidant element, is actually higher when the tomato has been cooked. So when you've been through the process of making your pasta sauce, it will have higher levels of lycopene than when you eat them raw, which is quite unusual because a lot of the vitamin C and other antioxidants can reduce in a lot of other foods when we cook them. Lycopene is also very good for your heart health. So for anyone who's at risk of heart disease, stroke, heart attack, and so on, really want a lot of lycopene in our diets. And also prostate health has an impact. How does it affect your digestion? Well, tomatoes are high in fructose. So raw tomatoes could draw more water into the bowels, causing bloating or loose stools. Fructose is one of the FODMAP groups, and if you don't absorb it very well, then it can create a lot of your IBS symptoms when eaten in large amounts. Undigested fructose can also then travel to the large intestine where it's fermented by your gut bacteria. So if you're not breaking it down earlier up the digestive process, then it can start to ferment and create more problems and excessive gas in the large intestine. Another reason why people may find a reaction to tomatoes is that they may contain histamine. It's a natural amino acid which can trigger gut symptoms like pain, maybe diarrhea or bloating if you're very sensitive. Now, some people with histamine issues will not have the typical allergy type symptoms such as runny nose, itchy eyes, wheezing, that kind of thing, like the hay fever type symptoms. But that is typically where people are getting high histamine reactions. They're also getting skin rashes, breathing difficulties, runny nose, that sort of thing. Some people will just get digestive issues though, like pain, diarrhea, maybe bloating. And finally, the other reason tomatoes might upset your digestion is if you've got a lot of acid reflux, you've got gastritis, a lot of sensitivity in the lining of your stomach, then theoretically tomatoes may increase the acidity, particularly a lot of raw, maybe slightly unripe tomatoes that could be quite acidic. That could add to the acid levels in your stomach, and then that could just make it feel a little bit sore or increase the feeling of acid regurgitation, as in reflux. How to eat tomatoes? Well, cooked tomatoes or tinned tomatoes tend to be much easier to digest. If you struggle with histamine, then freshly cooked tomatoes are normally easier to digest than when you're eating leftovers from the day before. If FODMAPs are more your issue, then again, tinned tomatoes, you can eat a lot more of them in volume than you can when they're raw because of the fructose content. It's much higher in raw tomatoes. So with raw cherry tomatoes, you can have 4 or 5 before it then becomes a high FODMAP meal. When you're talking about a big tomato, you can have up to half a medium tomato, and then over that, it's a high FODMAP meal for fructose. So there we have it. Tomatoes are very good for you because they are the base of a lot of cooking. It's quite hard to avoid. If you haven't tested tomatoes for a long time, I would start with tinned tomatoes and try up to 100 grams per portion, but just start with a really small amount, or try some tomato puree and adding it to a meal and build up from there. Tune back in tomorrow to hear the next 30 days of IBS foods. I'm talking about cheese.